Which fetal structure allow blood to flow from the right atrium directly into the left atrium, bypassing the lungs? A. Ductus arteriosus, foramen ovale, ductus venosus, and the umbilical artery. So correct answer is B. Foramen ovale. So rational. In fetal circulation, the foramen ovale shunts oxygenated blood from the right atrium to the left atrium, thus allowing blood to bypass the non-functioning fetal lungs. So why fetal circulation is different for NCLEX point of view, it is very important. So fetal lungs, they do not work properly and oxygen comes from the placenta. Blood must bypass the liver and lungs. So it is done by the three shunts that is very important for NCLEX. The first is ductus venosus. Ductus venosus, what is the function that carry blood from the umbilical vein to the inferior vena cava and it bypasses the liver. So the ductus venosus contains 80% of the saturations of oxygen in that blood. So it's carry blood from the placenta to the fetus. Next is foramen ovale. Foramen ovale that is structure present between the right atrium to the left atrium. So it allow the blood to shunt from right atrium to the left atrium. Okay, then next is, and it bypass the lungs. And third one is ductus arteriosus. So that is function, it is carry blood from pulmonary artery to aorta and it bypass lungs. So remember DFD like ductus venosus, foramen ovale and ductus arteriosus. And one more important, there is two umbilical arteries and one vein in the fetal circulation. So umbilical arteries that carries less oxygen, like oxygen saturation that is less in the blood, and the it means deoxygenated blood, and the umbilical vein that carry oxygenated 80% of oxygen saturation in that blood. And step by step blood flow for NCLEX. From first is from placenta to fetus. So from placenta to fetus, it can carries umbilical vein that contain oxygenated blood from comes from the placenta by umbilical vein. Second, liver bypass. So blood enter into the ductus venosus that goes directly to the inferior vena cava. It bypasses the liver. After that, for third, blood from right atrium to left atrium. So blood enters in the right atrium, then majority of blood goes through the foramen ovale to the left atrium, then left ventricular, then aorta, and aorta supply brain and heart with most of oxygen. After that, right ventricle path. So remaining blood that enter in the right ventricular, it goes to the pulmonary artery. Since the baby's fetus lungs that are non-functional, so blood goes through the ductus arteriosus to the descending aorta. So after that, back to the placenta. So deoxygenated blood returned by umbilical artery to the placenta. So that is the quick remember for NCLEX point of view. So but it is very important to remember AVA, AVA, two arteries and one vein in the fetal circulation. That is very important. So save this video for revision and subscribe my channel Manpit RN Talks for daily NCLEX tips. So your NCLEX success starts here. Subscribe my channel and study smart.